Hi everybody, I'm Laurie Cadden, and we are in the wonderful doctor's office of Pediatrics of Northeastern Pennsylvania, or any PA, with two lovely handsome guys, because I only do shows with handsome men. That's just the bottom line. That's when we got this gig going. I said only if they're handsome, and scored again.
You were lucky.
So we are here. We're once again doing the fourth, which I can't believe already this year, for the Lackawanna County Medical Society's Public Health Education Series. We're here to talk about immunizations for both children and adults, and we have two guys who are well versed in both of these. One is, I have full disclosure, Dr. Timothy Welby is a dear friend of mine. He was also my children when they were babies and little. They're now 22 and 27, no longer here, but he was their doctor, and he was wonderful, and I love him. He's terrific. And Dr. Timothy Welby, who again is with Pediatrics of NEPA. And then we have wonderful, I'm going to say it right, with the Right Center, we have Dr. Praven Chaco. Did I say it right? Yes, Tim, see?
You did a wonderful job.
Tim said, you're going to say it wrong, and so I did it.
We're not finished yet.
I know. Shh. Okay, so we're going to talk a little bit about immunizations. As I said, we have to talk about the pediatric side and the adult side, why it's important, what can happen if one doesn't and the other one does. It's very, very important. It's a hot topic. Should you, shouldn't you? We want to talk about that so you can be a little more educated on how, when is the best time, what you should do for your children and you as an adult, and make everybody and the household as healthy as can be. So, Dr. Welby, what are actually immunizations and how do they work?
Well, immunizations are like a medication that we give to children and adults to protect them from infection. And the way they were developed is similar to how when you get an illness, your body develops an immunity to it, antibodies and various other immunities to it, so you can then fight it off. Well, instead of making the child or the adult go through the illness, by immunizations, you can sort of fool your own immune system into being ready, and when you're exposed to that illness, you can fight it off, you don't get sick, or you don't get as sick as you would have. And it really has prevented uncounted deaths and morbidity and mortality. Just wonderful thing that modern medicine has been able to do to prevent illness in children and adults.
So it actually is the actual stuff being injected into?
It depending on the vaccine, a form of it. Some vaccines are actually live or killed or attenuated viruses or bacteria. Some vaccines are just small proteins or sugars on a bacteria or a virus that then alert your immune system when you do come in contact with this, fight it instead of getting sick from it.
Okay, so because you always hear these things, they say, the flu shot, which I have never, ever received. I'm 55, full disclosure, and never received it. And I'm afraid of it because I'm thinking, doesn't that like stick that stuff in me and now I have to fight that, and do you get sick after it? So I think people struggle with all these things. I never once struggled as a mom getting my children their immunizations, maybe because I wasn't getting it. I don't know, but I just never did. So that is a misconception, do you think? Or do people fear that? What do you think about that?
It's easier to give it to your children because you're really protecting them. When you're talking about yourself and adults, people get nervous about the flu, and you address that.
And it's fascinating to know that there is no flu vaccine that's approved for less than 6 months, which means they get the protection when the adults vaccinate themselves. So that's an added incentive for them to actually vaccinate themselves. They protect their kids. And another well-known fact about flu vaccines is that it can actually protect your heart. And this is a recent study that's come out. So there are two advantages.
Which one, doctor? I'm sorry. With
the flu vaccine.
Really?
The flu shot, they are actually cardioprotective.
I've never heard of that.
It's something, it's a unknown fact. Kind of thing? Yeah, it's an unknown fact. A lot of people don't know it. That's another way we try to tell them it's always good to get your flu shot.
What about the question, if I get the flu shot, I'm going to get the flu?
Yeah.
What do you tell people about that?
And I get this question almost on a daily basis when it's the flu season. Oh, doc, last year I took the flu shot and I got the flu the next day. But that's just the case that you just got exposed to the flu maybe
beforehand.
Beforehand, exactly. And then you get the flu shot and you blame it on the flu shot.
And I think that's what, because you're getting it in the season where it's flu season, so I guess that makes sense. All right, so getting your child immunized as well as yourself. As you said, doctor, before, that you're protecting yourself by getting these things. What is the converse? The child who gets immunized, does that help an adult?
Well, it does, and the flu vaccine is probably the best example of that. One of the reasons that we immunize young children is they get very sick with the flu, or children with asthma or diabetes get terribly sick with the flu. But over the past 10 years or so, we've started immunizing everyone because it's the 6 and 7 and 9-year-olds who come home from school with the flu, who give it to their grandparents, who then are elderly and can get horribly sick and unfortunately die from the flu. So immunizing your children against the flu and other things protects everybody in the house.
Okay, so then when you do get it and you decide that these immunizations, I mean, I thought, and we'll get into, maybe this is part of it, I'm not 100% sure, but I know years ago when my children were little, they had to have these shots before they could go to school. Is that the same now, or has that changed?
It hasn't changed in that there are a number of vaccines, and in the state of Pennsylvania, to go to public or private school, you have to be vaccinated, with rare exceptions. But the flu shot is not one of those that's mandatory.
Okay.
Now, for adults in the workplace, there are probably similar things.
Right, and to get into like work or go back to college, you do definitely need to show records that you were immunized. It's always good to get your vaccines. If you don't have a record, you can always get your titers, levels checked. It's always good to keep a good record of all the vaccinations that you've taken. Those are a few things that I could think of. And especially for healthcare professionals, you definitely need to be vaccinated.
Yeah. And it is once a year on the flu, right? It's every
It is
year.
once a year.
And talk a little bit too then, doctor, on the adult side. What are some of the side effects from, if there are any, if there can be, what would some of those things be once someone received an immunization? What would the side effects may be?
So as Dr. Welby said, that vaccinations are like medications, and as in medicine, nothing's 100% safe.
Right.
You do have side effects from them, and you should always talk to your doctor about what side effects you can get from them. But these are very rare side effects. The most common reactions may be a little bit of pain at the site of the injection, and maybe a little bit of fever, but this is something that can be just treated with a little bit of Tylenol or an aspirin.
Yeah.
Right. Most of the other ones are extremely rare that you shouldn't, it's not significant enough.
And the same on your end with the kids.
The same. Fever and soreness are common, actually, in children when they get the flu shot, but they're nothing compared to the flu itself. And rare, severe side effects are just that. They're very rare.
And the missing of school and everything else with this, whereas a little tiny little irritation possibly, it makes a big difference.
Better to be sore for 2 or 3 hours than to miss a
all
week
the-
of school.
Exactly. So then what do you believe then, obviously, because this is sort of a no-brainer here, but so you both believe that the risk or the benefits far outweigh the risks of any of these type of immunizations?
Absolutely.
On both the pediatric and the adult side?
Yeah, there's a lot of misinformation from a lot of different areas about vaccines and their effectiveness and their side effects and so forth. But the truth is that, anybody who works in the pediatric or the adult world, very strong proponents of vaccines because we see the good they do. And from the adult standpoint, I assume it's the same.
Right. I mean, the three most common arguments that I've heard against vaccines have been, they call it the fate, the free rider, and, it decreases immunity. By fate, I mean they think that, I won't get the disease. By free rider, what I mean is that, if I don't take the vaccine, it's okay, but everyone around me has taken the vaccine, so I'll take a free ride in that situation. And the immunity is, they think that it'll decrease the immunity, whereas science has shown us that it's the other way around. It increases the immunity. So.
I like it, free rider. I think I qualify for that. I think I do. It's better than a freeloader. So when you see these things, a reaction, let's say either side, obviously you would, if you started to see something where your child or an adult was having a reaction, it says, what's the best thing to do? So what is the best thing? Call your doctor, call 911. What do you do if something looks like it's causing like some kind of anaphylaxis or something? What would happen? I mean, could that happen with that?
That does happen. Almost all the vaccines have a very small rate of anaphylaxis because you can be allergic to one of the components of them, but that's exceedingly rare. The common things, the fever and the aches and pains and things, that can happen 2 minutes later or a day later, and that's not serious. And you certainly always call your physician. But the serious bad anaphylaxis, trouble breathing, all those awful things, they're going to happen immediately. And you're going to be in your doctor's office when it happens. And in the rare, I've never seen that happen with a vaccine, and the day I do, I want to be in this building and not somewhere else. So from a pediatric standpoint, anything awful is going to be right away and exceptionally rare.
Because you were saying, doctor, that you never know, nothing is 100% safe, because you never know how your body is going to react to it from an allergic standpoint. What is going to, or from if you have an allergy that you don't know, and all of a sudden, hey, it pops up. I mean, one time I took a medicine, I took it at least 10 to 12 times, I had no problem, and then I became allergic to it. It just, thank you, because I'm putting it in my face. So it's amazing how this stuff works, and then you have others that would happen instantly. So the best thing to do then is do what you said, and I cut you off, Doctor, I'm sorry, so please continue.
I mean, the only thing that I could add with the other ones is we focused a lot on the flu vaccines, but there are other vaccines that, although you get vaccinated as a child, you do lose like the immunity power later on in your years. So CDC recommends that you get your tetanus shot every 10 years, you get your pertussis shot every 10 years. Getting the pertussis or the whooping cough, it's not. It's nothing compared to getting the shot. Your shot is just a pain for that second, but getting the whooping cough, you'll be sick for days, and you have to compare what's better. So that's what I would think.
And then tell me too, why is there a difference between a child and how many times they may have to be vaccinated versus an adult?
Well, most of that reasoning is because child's immune system is so much different.
Okay.
It's better in a lot of ways, right? As through your childhood, you can fight off disease better, you build immunity better than you do when you're elderly. But in order to fight some of these diseases, you need multiple exposures to the vaccine because there's such a tiny amount in the vaccine so that you don't get bad side effects from it. You need multiple exposures to really build up an immunity.
And then it gets less. Now, what about the whooping cough? What about that vaccine? How often? What should happen with that? Because all these commercials now, you see that your brand new child goes in to see its grandmother, and she turns into the wolf. So what happens?
So usually with the whooping cough, so again, it's just the severity of the disease that you get. So it's the acuity of the illness. What I mean is that how severe you can be hospitalized. You can literally be bedridden for about 10 to 14 days, and you have to be in the hospital. You have to be isolated. You have to be away from work. It's a terrible disease. It's something that you could have just prevented by getting a single vaccination.
Is it something that can come back? I mean, once you have it, you can get it again?
Right, surprisingly. So that's what the CDC recommends, that you get the shot, the Tdap shot, or the tetanus, diphtheria, pertussis vaccine. You have to get it every 10 years.
Wow.
Yeah, so it is showing some kind of recurrence in the United States, and it's something that we always encourage, and we always keep a track of whether you have taken the medication.
Because of increasing rates of pertussis across the country, they now are pushing it more, and you're seeing ads for it on television. And the new recommendation, I think about 2 years ago, is with every pregnancy, a woman should get the pertussis booster. Because the issue there is children in the first year of life are very susceptible to it, and they don't get their full primary series till they're 18 months old. So if you're pregnant and you get sick and you give it to your 2-month-old, they're going to get very sick with pertussis. Pertussis would be a terrible cough in me for a few weeks. It can put your baby in the hospital. It can put your 90-year-old mother in the hospital. Your mother's not 90.
Yeah, I know that. I know, thank God. Our mothers are the same age,
That's
by
right.
the way. Let's reveal it. No.
Oh, no, don't, yeah.
But so then you guys were saying earlier too, the fact that the disease, as I said, I don't want it because it's going to put the stuff in me, and what if so any disease or can the disease manifest itself or pop up in an immunization after someone gets an immunization?
Absolutely. The chickenpox vaccine is a very good vaccine, but children can get both of the chickenpox vaccinations in their youth, and 5, 6, 10 years later get chickenpox, but instead of 300 and a week out of school, they'll get 4 chickenpox, and it'll be moderately attenuated or easier to get through. So you can get some of these illnesses after you've gotten the vaccine, but they'll be very, very mild instead of potentially severe or life-threatening.
Yeah, and it can be. And do you find, I know with the anesthesia that they say when Sean was having his tubes put in his ears at CHOP, they said because he's light-haired, light-skinned, light eyes, he may have another reaction to, a different reaction to the anesthesia than a darker-haired kid with darker skin or darker eyes. So do you find that has any, I know when I had the chickenpox, I had them everywhere. It was horrible. So do you see a difference in the severity of how that is versus what a kid's color, is, or their hair color, eye color?
I'm not aware that there's any specific thing for chickenpox or really for any of these illnesses based on your hair color, your eye color, any of that.
Matter.
It doesn't matter. You can look as white as a ghost and get severe chickenpox or very mild, and that's vice versa. So no, I think it's a matter of how severely you get affected and what your immune system is like, I think.
Yeah. I do want to address the other fact that we have a lot of fear that we are injecting something that's live inside the body. The safe rule is that most of the vaccines that we get here in the United States, for adults at least, 90% of them are actually dead, or at least just parts of the virus that act like viruses. So it's always safe to assume that they are not live. There are few vaccines that are live vaccines, but they're completely attenuated, which means they don't have the potency of the real viruses.
Okay.
Yeah.
And then, so tell me on both ends, because this is again for both of you, if as a child, because Doctor, you just said that you should get that every 10 years or so, if as a child we think, hey, we're done with our immunizations, we never have to get them again. The only thing I might have to get is possibly a flu shot, or I get lots of shoes, a flu shot, or possibly a, help me, shingles,
Chickenpox.
any of those later. But you're saying now, if I heard you correctly, that it should be every 10, and you're saying if you're pregnant and with every pregnancy you should have it, which obviously most pregnancies aren't 10 years in between, so that would be far greater than a 10-year span. So that is that just more of a modern science that they believe that this is really what you're finding after all these years, or is it something that's been going on forever and we just didn't do it?
So what I've found is that there have been a lot of new vaccines that have been developed recently, that although they're indicated just for children, a lot of our adults haven't got those vaccinations when they got their vaccination. So it's always good to check with your doctor to see if you've got all your vaccines done, right?
Right. And there are, some of those indications are new, with every pregnancy. And there are some things when you think, well, I've had all my childhood shots. Well, maybe you're 16, but you haven't had your meningitis shots for college, or you maybe haven't had your HPV shots yet, although you should have. And as an adult, the Zostrix, the shingles shot, and then I don't know this because I'm a pediatrician, but also the Pneumovax for pneumococcal pneumonia for adults. Can you speak to that?
Oh yeah, so getting a pneumoshot. So if you have asthma, lung disease, heart disease, if you're a smoker, and definitely age more than 65, you have to get a pneumonia shot. So pneumonia shot not just prevents the pneumonia, it prevents a severe blood infection, a bacteremia. So these are, and even meningitis, that's caused by the pneumonia bacteria. So
What is pneumococcal, if I'm saying it? How do you say it?
Pneumococcus.
Pneumococcus.
What is that different than just say pneumonia, or is it the same thing?
So it's caused by this organism called the Streptococcus pneumoniae. And it can go to your lungs, and it can go to your brain. It can also go into your bloodstream. So these are the three areas where this vaccine can actually protect you from. Especially our older generation should always get a pneumonia shot, because it can prevent pneumonia that can be life-threatening, and then it can cause a lot of morbidity. They can be intubated, and you don't want that.
I do hear so much with this pneumonia that someone, say older, or someone who has their health is compromised in some way, that pneumonia is oftentimes what gets you in the end, so to speak. It attacks. Is that now pneumonia is an infection, a lung infection? What actually is it? If someone could explain.
So pneumonia, as the name says, it means bad air, but it just is a lung infection. It can be caused by several things. It can be caused by a fungus, it can be caused by a bacteria, it can be caused by a virus. But what we can treat is using this vaccination, we can prevent the pneumonia, which can actually give you immunity against the Streptococcus pneumonia. So it's just one aspect of it that we can prevent. So you can, what you have in your hand, you can control, right? If it's not in your control, you can't control it. So you can help yourself by giving this vaccination. It can prevent a lot of other problems in the future.
And tell me what age you should get that. At which age?
For the pneumonia? Oh,
Yeah.
so the pneumonia shot, so again, it's age more than 65.
More than 65.
Or if you have a heart condition, lung condition, asthma, or you're a chronic smoker. So these are
Okay.
the conditions where we look at.
And what about the shingles virus? Is that a 60, 50? What is that number?
So shingles virus, again, it's based on when you get approved for it. I think it's 65. I have to check again, but
Yeah.
it's 65 and above that you get your shingles shot.
And even if you had chickenpox as a child, you should get it?
Absolutely. Even if you've had chickenpox as a child, you lose immunity for it, and you do have to get your shingles shot.
And people who have not had chickenpox as a child, can they still get shingles?
Oh, absolutely.
Really?
They can get,
So it
yes,
doesn't-
they can get shingles, yeah.
Okay,
Yeah.
and then tell everybody, who would be someone who should not be immunized?
There are, again, we're big proponents of immunization, but there are certain people who should not, right? For children specifically, if they have severe immune deficiencies, if they're on steroids for a chronic illness, if they're unfortunately on chemotherapy regimens for cancer, if they're allergic to any of the part of the vaccine, those are all what we call contraindications. You should not get the vaccine because the risk is higher than the reward, but that's a very, very small subset of children.
So as Dr. Welby said, an allergic reaction. Certain diseases like HIV, again, you have to talk to your HIV doctor, but most of the vaccines that you can get as an adult is usually a dead virus. It's just part of a virus that cannot be activated. So it's always safe, and if you talk to your doctor, they'll know, which is safe for you in your condition, in your particular disorder.
Okay.
So a lot of, as Dr. Welby said, there are a lot of immune deficiencies, like when you lack immunity. In those situations, you shouldn't be taking the vaccine.
Okay.
So it's very rare, though.
Okay, so tell me too, is the doctor's office the best place? Because I know you can go to a pharmacy. Where is, or doesn't it matter? Give your professional opinion on where's the best. Go ahead, say. He's gonna say, come to the doctor.
I was gonna say, come to the doctor. You know what I will honestly tell you? The best place to get it is where you can get it and where you're
Okay.
going to get it. Flu shots especially. That I don't care if you go to the drugstore or the Mexican restaurant, wherever you can get your shot, you should get your shot.
Yeah.
I will say
Well,
that
you're
for
having your
children,
taco, you-
you get a shot.
Okay.
A lot of the pharmacies and the ready care type places, they don't always immunize children under a certain age because they're afraid of a severe reaction. If that happens here or at the hospital, we're equipped to deal with that. At the pharmacy, maybe not the case. So in younger children, not always, but for the vast majority of people, anywhere you can get it is the best place to get it.
Right, I agree. I mean, your workplace is an ideal place to get it. Workplace, doctor's office again, and pharmacy. Those three most common places that a lot of our patients get it, right?
Okay, and then as far as our last one, we kind of covered this, but one more time just to seal the deal on this. If you could tell everybody, how often do you need them? Reinforce that before we end so people get again when they need it, both from the children's standpoint and the adult.
Well, from a children's standpoint, there's a long list of shots that children need and the ages at which they need it, from 2 days of age till the day before you go off to college. And the best way to know that information is talk to your doctor.
Okay.
From a flu shot standpoint, it's every year. And beyond that, there's so many in children. I don't want to give you a laundry list,
Sure.
but talk to your doctor. And again, we tell everybody, listen to your doctor's advice, right? A lot of people will tell you a lot of things, but that's the one person you're paying for advice. Try to listen to what they're telling you. And just as a plug, the American Academy of Pediatrics, the Center for Disease Control, AAP, or CDC are wonderful websites to get information on what your child needs from a children's standpoint.
Okay.
And the bottom line is vaccine saves lives. And we have decades of evidence to show that, a lot of lives that have been saved with vaccines. So just to briefly about the adults, tetanus shot every 10 years. They get it as a Tdap, which is with the pertussis shot, which comes again every 10 years. And then the pneumonia shot, as I said, after the age of 65. If you have a lung condition, asthma, if you're a smoker, you do have to get your pneumonia shot that can prevent a pneumonia in the future. And the chickenpox. If you've not got a chickenpox as a child, you should always get a varicella vaccine. And then you have a whole set of pregnancy-related. And if you're traveling to another country, that's an important vaccination that you get. If you're going to an African continent, you're going to India, you've got to get your
And
vaccination.
even this like Zika stuff too, that's a whole other story, right?
Right, that's a whole other story, and I hope we get a vaccine for that.
'Cause, yeah.
Yeah.
That'll be the next thing we talk about. Next year when we come
Next
back,
year.
we'll have another doctor here talking about Zika.
Zika
So,
doctor,
yeah. We're becoming human pincushions, right, with all this stuff?
Which is better than being sick.
You're not kidding. I'll take it anytime. Well, no, okay.
Although you don't.
But anyway, we'd like to thank both of you for joining us today. Is there
Absolutely. Thank you.
anything else you'd like our viewing public to know that maybe we didn't cover?
No, as we say all the time, if you have questions or concerns about vaccines, talk to your doctor.
Okay.
Doctors are always happy to talk about that because most of us are very, very pro-vaccine.
Okay.
And I want to underline and double underline what he said.
Okay. Talk to your doctor.
Talk to your
Communication is
doctor.
key, right,
Absolutely.
on anything.
Yeah.
Okay, so I'd like to thank Dr. Pravanchako.
Thank you. Yes,
From the
perfect.
Wright Center,
Very nice. Very well
and
done.
Dr. Timothy Welby from
well done.
Pediatrics of NEPA. And next time, our fifth one will be, is there a drug problem lurking in your home? We will have Dr. William Dempsey and Scott Constantini from the Wright Center at the Abington Public Library on October 12th at 7 p.m. So we're going to do a little bit. I think we'll have some interactive stuff, or at least people to view it, and we'll see what happens. We're going to talk about that because of the severe drug problem. We want people to be prepared and know what's going on. All of these shows are sponsored in part by CHS, and we thank them for that. And I'd like to thank you for watching, and both of my friends here again. So nice to meet a new
Thank you.
doctor,
Thank you.
and your lovely Right.
Thank you.
Beautiful. So thank you again. Have a great week, everyone, and we'll see you next time for our 5th show. I'm Laurie Cadden. Thanks for watching.